Dr. Lopez, how deadly is lung cancer?
Lung cancer is actually the most important cause of cancer deaths in the U.S. today. And unfortunately, out of the 165,000 patients that develop the disease every year, a large number actually die from the disease as well. And we're working as hard as we can to change that reality.
Is it very common in the Hispanic population?
Yes, it is. It's actually the number one cause of death for Hispanic men and number two for Hispanic women.
I see. And now is there much more hope for treating lung cancer?
That is also correct. We have ways of course, people who stop smoking, we know that we can do that to prevent the disease for many patients, if not all. We do know that if we do CT scans for patients that have smoked, we can detect the disease earlier, just like a screening or a mammogram does for breast cancer. And we also know that even for patients with advanced disease, we now have targeted therapies and immunotherapies that can help them live much longer with better quality of life.
Can you explain a little bit about target therapy and immunotherapy?
Absolutely. So over the last few years, we have discovered that cancer cells have different molecular changes that make them different from the normal cells. And we have been able to develop medications that can target those changes. And by doing that, they have better efficacy and fewer side effects, helping our patients live longer and having better quality of life. Many of these are actually even tablets, so it's a lot more convenient for patients to take them as well.
I see. And that's the target therapy and immunotherapy are taken together?
So today we actually use them differently. Each patient's tumor is tested to see what medication is the best. For patients that we find something called EGFR, we use EGFR inhibitors. For patients that we find a different change called ALK, we use something called ALK inhibitors. And we also have different markers that we use to choose patients that do better with immunotherapies. So every patient is treated as an individual, and we choose the best treatment based on the changes that we see for each patient's tumor.
So we can say it's customized therapy?
Yes, it is. Individualized and customized.
I see. Okay. And what about clinical trials? How can one get involved in clinical trials?
So clinical trials are the way that we actually develop these treatments, and we need to do more of them and have more patients participate in them as well. Clinical trials are studies that help us see if medications are safe and effective, and we do need a lot more support. If you look at the most common cancers, lung cancer is actually the one that gets the least amount of funding for both clinical trials and research studies, and we absolutely need to change that. We would love your listeners to come to our website, which is lcfamerica.org.
Oh, slow down. Let's get that website
Thank you.
again.
Sure, that's lcfamerica.org.
lcsamerica.org.
.org. And that stands for the Lung Cancer Foundation of America.
Lung Cancer of America?
Lung Cancer Foundation of America, that's right.
Lung Cancer Foundation of America. Okay, that's very useful information for people who are interested in being involved in clinical trials.
Yes.
Millie, tell you, how did you feel when you got your diagnosis, and how are you doing?
Well, June 22nd of this year, actually, my doctor called me and told me that I had cancer. At first, I couldn't believe it because I never smoked. I was never surrounded by people that smoked. So at first, I thought that they had made a mistake. I was devastated, of course. And after the news settled, I thought about my daughters, who are 3, 7, and 9. I thought about who will help them in their everyday things, if I was going to see their future, if I was going to be there for their future.
Right.
So it was very difficult at first. But luckily, I've been taking a targeted medication, which has helped me control the cancer for now. However, I know this medication is not going to last forever, and that's why it's so important to raise awareness and to, fund organizations such as the Lung Cancer Foundation of America, where they will try to find all the research possible so people like me can live longer.
Okay, you sound like a good advocate.
Yes, I try to be. 5 months ago, I would never thought that I would be here. My life has completely changed But, I am grateful every day to God that I have one more day with my daughters.
Well, I am too.
Amen.
And let me thank both of you for sharing this information with my Health Power audience today.
Thank you, Dr.
Thank
Goodwin,
you.
and have
Thank
a good day, everyone.
Thank you.
Yes.